Welcome to today's session. Today we are discussing addressing concerns in pediatrics. So we are going to talk about how to address concerns in pediatrics, how to give reassurance to parents when they have come for consultations for their child. It is also important to understand the sentiments with which you are dealing here. A parent's concern for their children can range from queries and complaints. You are expected to navigate through these, analyze if anything is worth escalating, and give reassurance when no imminent emergency is indicated. In the coming slides, we are going to discuss how to give reassurance. Although I am discussing only one scenario here, in the coming days, I am planning to hold some practice sessions. So if you are not on my WhatsApp group, please do contact me, and definitely you can benefit by doing so. Right. So before we begin, I would like to talk a little bit about the services which are offered by me. So you can send in queries and bookings for private practice sessions with me. You can book a mock test, and you can also take up a short course. So please do contact me for more information. How can you contact me? Everything is given in the description box below, so please do check that out if you'd like to contact me. Right. Moving on. So let's talk about what are we going to do today. We are going to talk about the clinical scenario, the structure, history taking, examination management, and finally ending with find us, like us, support us, and thank you. Right, so this is what we are going to discuss. So moving on, let's see. So the scenario that we have is, you are a junior doctor in the GP clinic. Mrs. Daisy Reed is the mother of 15-month-old Luke. The mother has requested to speak to a doctor because she has some concerns regarding her son. Please talk to the mother over the telephone and discuss the plan of management with her. This is the scenario that you have. Okay, so let's talk about this. Now, as you all know, I had advertised, or I had put up on the Facebook group about the structure, that is CHEM. Now, what does this structure stand for? So let's go and dive into that and see what does it stand for. So basically, it stands for concern, history, examination, and management. So this is the structure which I have for you, especially for counseling scenarios. We will discuss each of these components in detail in the coming slides. Right? Moving on. So this mother comes in with a concern that her child is not walking in comparison to the friends of the same age. Okay, and this is what the mother has come in for. Now, keeping in mind the structure of pediatrics, we would also like to ask all the concerns the patient has come, or the mother has come to the clinic for. Take a history. Ask if there's anything else that the mother has noticed which led them to decide for this consultation. Her concern is regarding walking. Is there any other developmental concern? That's what I mean when I say encourage the patient to talk. Are you satisfied with your child's attainment of other developmental milestones? So you'd also like to know what is going on. What are the other milestones that the child has achieved, and is the mother happy regarding them? Apart from this, you also want to have an idea whether what is the child able to do now. Are they able to stand with support or without support? How do they move about? So the mother here says that the child is able to stand with support. The child does cruise, and they are also able to move about by crawling. Now, what is cruising? Cruising is basically holding or standing with support and walking with support. That is cruising. Okay, so this child is able to cruise. That's what I mean when I say that the child is cruising. What are your differentials here in this scenario? Your differentials here are congenital dysplasia and isolated delay of a milestone. Now what happens in congenital hip dysplasia is the parent may notice some clicks while the child crawls or while they are changing the child's nappies. What do I mean when I say the child is floppy? Child being floppy points out towards isolated delay of milestone, which can happen due to a trigger such as a previous history of meningitis. Okay, so this can be one of the reasons why a child has presented with an isolated delay of a milestone. Now, if your mother says my child goes floppy at any point during the presentation, please do ask her, please do clarify what does she mean by saying the child goes floppy. Ask her to explain the situation in her own words. Please do that. Okay, that is very important. Just because a parent says a term like floppy, it can mean something else in their slang, okay, and it can be something medically relevant. So my advice is, please do clarify what do they mean when they say that. Okay, now moving on. About the health visitor, I will talk about it in some time. Okay, now past history. So I want to know what is the child's past history. Is this, now where do I start with regarding the past history? Okay, I want to start from if the mother was diagnosed with any bleeding or high blood pressure while she was pregnant with Luke or this child. What was the birth of the child when the child was born? What kind of a delivery was it? And any low birth weight which was recorded. Has the child ever been hospitalized for any other serious conditions? Is this child vaccinated? Now, coming to the health visitor or the red book. So you can ask either of these two questions. You can ask, so do you have any concerns regarding your red book? That is correct. You can also ask, how about your health visitor? You said that you have this concern that your child is not able to walk in comparison to his friends who are of the same age. What does your health visitor think about this? So you can ask both these questions. Both are right, both are relevant. It's your choice. Okay, moving on. So you also want to ask about the child's diet, daily activities, and their bowel and wee habits. So please do ask about these things. You can also ask the mother, when you ask about the diet, is she happy with the child's weight gain? Now coming to family history. So you want to know who is there in the family. You want to know whether it is just the mother and the child, or there are any other carers. Is there the father involved as well? So please do ask those questions. Are there any other siblings? So this is also a relevant question which you can ask. Okay, with this your history is done. Now coming to examination. So what is this about examination that we want to talk? So if you are over the telephone, please make sure to inform the mother that when and why the child must come in for an assessment. For example, if the child has any clicks, or the child goes floppy, or there's anything positive in the history, the child needs to be called for a face-to-face assessment. Okay, if everything in the history is unremarkable, what you can do is you can offer an appointment after 2 weeks or a month. But please make sure that you are giving reassurance and encouragement to the mother or father in the management. Okay, so this is about examination. Now, if the child presents at 18 months, what happens is, if this concern is at 18 months, then definitely it needs an assessment by the child specialist, and you can inform the parent that we will make the arrangements and inform you regarding the same, but before that you may need to come to the clinic for some assessments by the GP clinic too. So this is about examination. Okay, these are the things that I have spoken about. One thing I do want to repeat: examination over the telephone. Please do correlate with the history you have on that day. Decide on the spot itself if there is anything in the history which warrants you to examine the child. Then please do explain that and say that you have said these things, so definitely we would like to take a look at the child, so please do bring them for a face-to-face consultation. So this is something you need to convey. Okay, moving on. I'm pretty sure by now you're quite aware of the DOTS mnemonic that I always encourage, right? Which stands for diagnosis, advice, review, treatment, and safety net or red flags. Now, for the purpose of this scenario, because you have already seen that our structure is CHEM, right? Now, I also mentioned that in this scenario, what you can do is you need to pay a lot of attention to the advice part of the DOTS mnemonic. Okay, now I would like to tell you some few details. I hope that they are relevant. Once I met an educator from a field unrelated to medicine, and they told me a pediatrician is a good one, or a child specialist is a good one, who can examine a child without making the child cry. As a doctor and a parent, I do not agree with them, because if you haven't spent some time counseling parents at the GP clinic or the pediatric department, then there are chances that the parents would not review with the child again or give a feedback that you may not like to read. But also please remember that for the purpose of a test, it is important, as most of us are parents here, to give good, relevant and meaningful advice. Please refrain from giving advice which is not medically relevant. How can you do that? How can you give medically relevant advice? Please do contact me, join my WhatsApp group, and we discuss all of this on a regular basis, right? Moving on. Now, why do I emphasize on reassurance so much? So in this particular scenario, right, reassurance is what constitutes advice. Okay, so we are going to talk about the significance of reassurance in pediatrics. Does it affect your score? Yes, it does affect your score. Like I mentioned a couple of times earlier also, that when you have taken a history and decided it is unremarkable, then you need to spend some time on reassurance / advice. How do you give reassurance? So basically, reassurance is a 3-part answer. Firstly, you acknowledge the emotion, that is by saying, I can see that you're quite worried about your child, that is Luke, who is not walking in comparison to other children of the same age. It is a valid concern and I can see how that worries you. Next, I'm going to talk about the course. So, when I asked you a series of questions, and from the information given by you, it is evident that nothing serious is going on. Each child attains their milestone differently, but a sufficient number of months is allowed in the range of which attainment of milestones is allowed at its own pace. Any milestone obtained outside the range of these months warrants an assessment by the child specialist. What I mean is that right now your child is 15 months old, so let's wait and watch until he turns 18. Now, if you have noticed, I have spoken about quite a long sentence. It is a long sentence. So what is advisable is that when you have said such a long sentence, please stop and ask your patient, are you following me? Are you able to follow what I'm saying? Is there anything you would like me to repeat? Okay. What I'm basically trying to say here is that I have acknowledged the emotion of the caregiver or the parent here. I have said that I do understand why this worries them, that is the child not being able to walk when the children in comparison to the child's age are already walking. So I have acknowledged that, and now I'm telling the parent or the caregiver the course, that is we have a range of months in which we allow children to attain their milestones. Okay, your child is 15 months old, so let's allow 3 more months. Okay, so between 13 to 18 months we have this range, which is the safe range. Any child who attains a milestone in the range of these months, from 13 months to 18 months, especially the walking milestone, is considered to be a normal, healthy growing child. This is what I'm trying to say to the parent. Okay, I have used some phrases which may sound a little complicated, I mean to all of you, to my audience, but if you are talking to the patient, when you say these phrases, this is what you mean, and I hope that I have conveyed this. Okay, right. Now let's go to the last part of the reassurance, that is advice, or how do you help this child when the child is at home with the caregiver or with the parent. So here's some advice. How can you help your child? You can do this by allotting a simple and safe play area at home. Leave the child with the toys, let them explore and play. The other thing you can do is you can play some interactive games, teach them to sing along and dance with you. It is very, very important that you as the caregiver and as the parent are calm, comfortable and reassured while helping your child. So what you're trying to say is that the mother's comfort is what is really important over here. Okay, this is what you're trying to say. Moving on. I've already spoken about this. I've spoken about a referral to the specialist and reviewing with the child and the red flags also. You can finish your management by talking about these points once again. When do you refer this child to the specialist? When there is something in the history that warrants an assessment by you, and then you will plan the referral to the specialist. So this is one scenario. The second scenario is you can ask this mother to keep a diary. She can note down the development of this child in regards to the particular milestone over the course of this 1 month. Come back to us after a month with the child, right? So we can assess the child and also take a look at the diary, okay, to see how the developmental milestone is being attained by the child. Okay, if everything seems fine, then we will call this mother when the child turns 18 months. Okay, this is the second scenario. The third scenario that can happen is this child has presented at 18 months of age, right, and this child is still not walking independently. So here you have to refer the child to the specialist. So these are the 3 scenarios that you can have. Okay, and I have discussed management of these 3 scenarios too. Review with the child. So like I said, after a month you can come back. Okay, red flags. What are red flags in this case? So we want to give specific red flags. I do not want candidates to go in and say red flags which are not relevant. So what I would advise is always say red flags which are relevant. What can you say? If you notice that the child is crying while trying to stand up on their own, or if you notice no improvement after a month, please do fix an appointment and review with the child. Okay, so these are my red flags here. This is what I want to convey to my simulator. Okay, so this is about the scenario. If you want me to summarize, I can do that too. What would I say in this summary is the structure. Once again, concerns. What are the concerns over here? That this child is not walking in comparison to children who are of the same age. This is the mother's concern. She has no other concerns except that she is wondering if this child needs to be assessed by a specialist. So these are her 2 concerns. Okay, in the history, when you took a history, you asked about what is the child able to do now. That is the first thing you asked. The second thing you asked about is the past history. How was the pregnancy? How was the child's birth? Any event after the birth which we should know? Is the child immunized? What is the opinion of the health visitor in regards to this concern? And lastly, about the child's diet, weight gain, any other developmental concern which the mother may have, and how is the child's wee and poo habits. So these are the things in the history that we want to ask. This is components of focused history. Please do keep in mind these things. Okay, moving on. Examination. So I said about the examination, decide then and there in the cubicle itself if you want to examine the child. Now, is there anything in the history that is positive? For example, this mother says, my child goes floppy. Do you want to examine this child? Yes, you do want to examine this child. So you are going to examine, or you're going to call this mother for a face-to-face consultation if you are over the telephone. If the mother has not brought the child, then encourage her to fix another appointment and bring the child for assessment. So if there is anything in the history which is positive, please make sure that you assess the child. What are you going to look for? You are going to assess the child. You're going to do a head-to-toe examination, do some measurements, try to analyze the child. How is their behavior? How is the interaction? All of those things. Okay, now moving on to management. So like I said, this is a pediatric scenario. This is also a counseling station, so please pay more attention to the advice part of the DARTS mnemonic of management. Okay, in this scenario it is a concerned parent, so you are talking to a concerned parent. So what I would advise is that give reassurance, and like I said already, reassurance is of 3 parts. The first thing is to acknowledge the emotion behind which the parent or the caregiver has taken this appointment. Acknowledge that emotion, give a solution, or tell them what is the course and what is going on with the child. What are we expecting? Why are we waiting? What is the normal range and attainment of a milestone between this 13 months to 18 months is the range that we allow for the child to develop the milestone or attain the milestone. So up to 18 months we can wait and watch. This is what you're telling the mother. In the meantime, you are also giving some advice which is medically relevant. Okay, now there are some other advices like using a buggy for the child to walk or putting the child on a walker. I do not encourage all those things, neither do I encourage my candidates to talk about those things in the exam, because as it is, you have 8 minutes to 10 minutes, right, or less than 10 minutes I should say. So please use that time wisely and speak of things that the parent or the caregiver can take home. Rather than giving them don'ts, it is advisable that you give them the do's. Okay, so give them the do's. All right, that looks more encouraging when you talk about the do's, and the don'ts, you can just include the red flags and the don'ts. That's more suitable according to me. This is my personal opinion. Okay, so that is about reassurance and advice. And lastly, you will finish up with review, red flags, and any other concerns, or is there anything that you can do to help this mother. So with this, you finish the scenario. If you have reached up to the end, thank you so much. Please do like my Facebook page. I do put on tips and tricks and a lot of other information which may be useful for you. So please do like my Facebook page. If you would like to book a mock test with me, you can do so by sending me an email on this email address. You will also find this in the description box below. Please subscribe to my channel. If you have any questions, please do leave them in the comments box. If you would like me to discuss any other scenarios, please do let me know. And as I already mentioned on my WhatsApp group, I'm going to talk about it once again. Midweek we are going to be practicing these scenarios, so I hope to see you all for the practice. We might be doing 2 to 3 scenarios, so please be ready. 2 people have already given me their names. If you would like to do it, please do let me know on the WhatsApp group, right? So these are some things that I wanted to talk about. Thank you so much. I will see you soon. I will see you next week as well. I hope that this scenario discussion has been useful. Thank you.